prepare a thing called, which is made up of menthol, thymol, and camphor. It was also prescribed during the COVID pandemic. Since male oil is hot and dry, we will include those diet which is cold and wet. It is very important to know what sort of person the disease has, not what disease the person has. Then we would
Have you ever felt out of sync, perhaps overly anxious or lethargic without a clear medical explanation from a standard health checkup? If so, Unani medicine could help you reach optimal health. It's an ancient healing system that wove its way from ancient Greece through the Middle East. Welcome to another enriching episode at Wellness Curated. I'm your host, Anshu Bahanda, and this season we're talking about healing traditions across cultures. And we're going to be digging into ancient medicinal systems and seeing how they can help us in our lives today. Now, as I was saying, Unani medicine is also known as Greco-Arabic medicine. And the father of medicine, Hippocrates, was known to have been probably involved in the origin of Greco-Arabic medicine. Hippocrates was born in 460 BC, and he actually took away the stigma of superstition and magic that was associated with medicine and gave it the status of a science. And after that, as we said, this medicine wove its way through the Arabic countries and developed further. The Unani approach is really intriguing, actually. They talk about four humours that need to be balanced. And these four humours are blood, phlegm, yellow bile, and black bile. And each humour is associated with a different bodily function and element. So, as an example, yellow bile is similar to fire. So people who have a lot of yellow bile are go-getters and energetic. But on the other hand, too much can also make you angry and irritable and also cause stomach issues. Blood, on the other hand, is like air. So people who have a lot of blood are of a cheerful personality. They're optimistic, they're friendly, but again, too much of it or an imbalance of it can lead to swelling and fever. And it's the balance of these four humours which makes us have energy and vitality. And that's what we're going to discuss today. We have with us a Unani medicine practitioner, Dr. Safina Anees, and she's at the Dr. Yassir Unani Herbal Hospital and Research Center in Tamil Nadu. So, Dr. Safina, thank you so much for being on our show and welcome to the chat today.
Thank you. Thank you for giving me this opportunity. My absolute privilege and honor to share such a rich Unani system of medicine, historical background, steps and treatments.
So, Dr. Safina, let's start at the beginning. Unani system of medicine, like we were saying, originated in Greece, right? And then it wove its way through the Arab countries and into India. And today it's really integrated into Indian traditional medicine as well. I grew up in Delhi. I don't live there anymore. I live in London, but I grew up in Delhi. And really at that point, it was as prevalent in our lives as Ayurveda was. So there was very little difference between, in terms of how many practitioners were there and how people used traditional medicine. We had as many Hakims as we did Veds. So tell me a little bit about the origins of Unani medicine. How did it spread in India? How is it, where did it actually develop?
Thank you. So Unani system of medicine has a very ancient and has a very rich and interesting historical background. The word Unani comes from Yunan, which means Greece. So more than 3,000 years before, Unani system of medicine originated in Greece, and the Hippocratic theory of humours lays the foundation for this system. Later, the other scholars like Aristotle and Galen followed his principles and developed it. But this knowledge of medicine came to Greece from the Egypt, Babylon, and Mesopotamian civilization. The Egyptians used medicinal plants, and that is the base of using herbs in Unani medicine. And in Mesopotamia, they used urine as a tool of diagnosis, which is still used today. After this, the Unani system of medicine came to the Arabs and Persian lands. There's a great scholar, great physician called Avicenna. He wrote his book, The Canon of Medicine, which is still read and used today. And Rhazes wrote this book called Al-Hawi, which also mentions the Unani system of medicine. What the Arabs did was they preserved this system, this Greek literature, by translating it into Arabic language. And they also enriched the system by their own contributions and by using many other sciences of physics, chemistry, biology, botany, physiology, and pathology. And around the 8th century, Unani system of medicine was introduced to India by the Arabs and the Persians. When it came, the Mughal emperors, the Delhi sultans, and the Tughlaqs, they readily accepted the system. They also gave state patronage to the Unani physicians. The Mughal emperors, they used to have these hakims in their royal courts. So at that time, 80% of the Indian population used Unani system of medicine. It was widely accepted by the masses in India, and it took its firm roots and found its permanent home in India. During the British rule, Unani system of medicine faced a little setback because of the introduction of the Western modern system of medicine. But still, during the freedom struggle, a great contributor of Unani medicine called Hakim Ajmal Khan, he established this Ayurvedic and Unani Tibbiya College and the Hindustani Dawakhana, which was inaugurated by our father of nation, Mahatma Gandhi. And after independence, the government of India supported this system and it grew with other Indian systems of medicine. There was a department called Department of Indian System of Medicine and Homeopathy. Later, it was renamed as Ayush in 2003. And we know Ayush, Ayurveda, Yoga, Naturopathy, Unani, Siddha, and Homeopathy. So now this department is responsible for the development of this system of medicine today. Today we can see Unani system of medicine is practiced not only in India, but Sri Lanka, Pakistan, Bangladesh, and parts of UK, UAE, and South Africa too. But India has the largest number of Unani practitioners, Unani colleges, research centers, and laboratories, both from the government and the private sectors.
Right. So tell me, how is it different from what is practiced in the Middle East today as medicine of the Tibbi medicine, or is it the same thing?
It is, in Unani system of medicine went to many parts of the world. In each part of the world, it is named differently. In the UAE, it is as complementary medicine. In the Saudi, it is called as Tib, but the system is the same, Unani system of medicine.
Now that you've explained the origins to us, will you explain the foundations as well? You know, you said it's based on the 4 humours, right? Will you explain each one of them? And how do you, as a practitioner, how do you decide what treatment to give?
Before going to the humoral theory, we have a very vast concept of Umure Tabaya, that is called the factors of human physiology. The entire human body is made up of these 7 factors, which we call as arkan, mizaj, akhlaq, aza, arwa, huwa, and afal. First thing is arkan, the elements, the 4 element theory. The entire universe, the entire world is made up of 4 elements, according to Unani. This aag, hawa, pani, mitti. Air, fire, and earth. And each of these elements have their own qualities. Like water is cold and wet, fire is hot and dry, air is cold and dry, earth is hot and dry. Hot and cold are the dominant qualities, whereas dryness and moistness are the recessive ones. Coming to the next factor is arkan mizaj. Mizaj means temperament. Thing in this universe, whether it is a living thing or a non-living, according to Unani, has its own temperament. Each person has their own unique temperament. There are 4 temperaments, that is hot, dry, cold, and moist. Next comes the akhlaq. Akhlaq is the humours. Humours literally means fluids or liquids in the body. These 4 humours are yellow bile, black bile, phlegm, and the blood. Even these humours have their qualities. Like the yellow bile, that is hot and dry, that represents the fire, and so on, the other. The humours are actually made from the food we eat. That's why ancient physicians say, you are what you eat. So humours which are there in our body, they come after the digestion and metabolism of the food we take. So the basic theory is when these humours are in a state of balance and equilibrium, then the health is maintained. Any imbalance in these 4 things, either quantitatively or qualitatively, the disease will occur. This is arkan, mizaj, and akhlaq. Next is aza, is the organs. Organs, there are 2 types of organs, the simple organs and the compound organs according to Unani. And the arwah is the pneuma. According to Hippocrates, the body is made up of 3 things: solid, liquid, and gas. Solid are the organs, liquid are the humours, and the gas thing is the ruh, which we call as pneuma, a spirit or the soul. The arwah, huwa, and afal. Huwa are the powers, the faculties. There are different powers in our body, like the immunity power, retentive power, the digestive power. So these powers are responsible for the normal functions of the human body. Next comes the afal, is the functions, the physiological functions of the human body.
Fantastic. I've been writing all this down. Fantastic. So you look at all these, but are humours more important or not? Or do you need to look at all these 7?
We need to look all these 7. And of course, humours are important, but all these 7 play a very important role in the health of the human body.
Okay. So tell me, what would you recommend to adjust in our lifestyles if we want to be healthy and to have a balanced life? I know that's a very long, deep question, but if you can give me a quick answer.
In Unani system of medicine, there is a classical concept of asbab-e-sitte zaruriya, the 6 essential factors, the lifestyle factors to prevent diseases and promotion and for the promotion of health. These 6 factors are, first one is hawa-e muhit, which we call the air, the surrounding air. According to Unani physicians, the air we breathe must be pure and clean to strengthen our immunity. Any impurities in the air will cause diseases. There is also a great concept of epidemic and pandemic in Unani literatures, which really helped during COVID pandemic also. There's called a bukhur, that is called fumigation. Fumigation of air with sandalwood and camphor can purify the air and disinfect the air from microorganisms. Next comes the makul and mashroob, we say, that is food and drink. The correct quality food and the quantity of food that one must intake has a great impact on their health. According to Unani system of medicine, one must take quality and healthy and balanced diet. And adequate hydration is also important. Hippocrates has rightly said, the cause of sickness is overeating and the cause of health is eating like a bird. The third one is harkat-e-sukoon-e-badani, that is physical rest and movement. There must be a balance in the physical activity and rest. Both physical exercise is also important and giving rest to the body is also important for the maintenance of the health. And that is a vast subject called riyazat exercise, different types of movements of the body. The fourth comes harkat-e-sukoon-e-nafsani, that is the mental movement, the psychic movement and rest. The mental movement, the psychic movement and rest. According to Unani system of medicine, the mind and the brain, the human brain, needs adequate stimulation and also relaxation for their intellectual well-being. The next comes the nom voyagza, that is called sleep and wakefulness. Proper sound sleep, at least for 7 to 8 hours, is important for our health. And likewise, wakefulness and movement of our body is also very important for our health. The last is ihtibas wa istifragh, that is called elimination and retention. Elimination of the harmful substances, unnecessary substances from the body keeps the body healthy. Too much of elimination is also bad for health. There must be a balance, elimination and retention. Retention of good substances in the body, and too much of retention will cause constipation, and constipation is the mother of all diseases. So all these 6 factors of asbab-e-sitte zaruriya is very important in one's lifestyle to maintain their health.
Okay, so this is about lifestyle, right? Now tell me about common treatments and techniques that Unani medicine recommends. Talk to me a little bit about the treatments.
There are 4 modes of treatments in Unani. That is called regimental therapy, dietotherapy, pharmacotherapy, and surgery. First, we go for regimental therapy, ilaj with tadbir. These are called the non-medicinal therapies. They involve certain techniques, and there are a number of techniques in these, like cupping, leeching, venesection, hammam, exercise, dalak, massage, and everything. One technique that is called hijama, cupping therapy. So hijama means to suck. In those ancient times, the horns, animal horns were used to suck. So it is also called the horn therapy.
And animal horns were used. Wow. Okay, I didn't know that.
In this procedure, a negative pressure is applied on the skin and the skin is pulled out. And there are many types of cupping. The main ones is dry cupping, wet cupping, and fire cupping. In the dry cupping, just the cups are placed and there are no incisions. And in wet cupping, mild superficial incisions are made on the body and the toxic blood is drawn out. And cupping fire is used. So these some techniques are used. It is also mentioned in Ebers Papyrus, an ancient, very ancient book of Egyptians.
Okay.
This hijama has very good instant, you can see instant results. You can see.
So that's interesting because a lot of us know it, as Chinese cupping, especially the fire cupping that you're talking about. So it's so interesting that you're saying all these three kinds are mentioned as far back in the Egyptian books.
In my dissertation, the thesis in my university, I was the first one to do this topic. I had clinical trials of cupping therapy in cases of sciatica. And Hippocrates has rightly said, where medicines do not heal, the lancet will. And where lance does not heal, the fire will. That was one thing from regimental therapies. Next is ilaj bil ghida, that is called dietotherapy. Unani physicians used to prescribe certain specific diets for certain ailments, and they used to alter the diet and eliminate some of the diet in their according to their diseases, and which is still practiced today. Third comes the pharmacotherapy, that is ilaj with dawa, and it is the most effective one in Unani system of medicines. Mostly it is herbs. Sometimes animal and mineral origin also are used in the natural form. Next comes ilaj bil yad, this surgery. This is the last option. When these three things do not work, go for surgery.
Apart from medicines, there are also holistic therapies in Unani medicine, some of which are dalk, which is massage, hammam, which a lot of us know of, which is the steam bath, hijama, which is cupping, and natul, which is irrigation. In fact, natul, I believe, is quite similar to shirodhara, where the oil is dropped on the forehead. Can you tell me quickly about those as well?
Ilaj with tadbir. Ilaj means treatment, tadbir means regimen, that is a systematic plan. It involves certain physical methods, certain techniques, mainly divert or to eliminate the morbid humor responsible for the disease and thereby to the immune system. Avicenna has mentioned 36 regimental therapies in his book, The Canon of Medicine. So the most important things mentioned today is cupping, bleaching, venesection, dalak, massage, exercise, nutul, enema, laxatives, purgatives, emesis, diuresis, absent, Pashoya, Bukur, steam inhalation, fermentation, Kai, cauterization. Before I told you about the cupping therapy, effective in all the pains. You can see instant morphine effect in cupping therapy.
Right.
It is advised in all types of pains like sciatica, arthritis, whether it is osteoarthritis or rheumatoid arthritis. Even in lifestyle diseases like diabetes and blood pressure, we have seen patients coming out of their high blood sugar levels. So after the cupping therapy, so there are three bloodletting therapies: the cupping, leeching, and venesection. In leeching therapy, medicinal leeches are used to draw a small amount of toxic blood from the body. It is very effective in skin diseases and in high blood pressure too. And venesection, which is called facet phlebotomy, an incision is made on a superficial vein and the toxic blood is removed from the body from the veins. This is very effective in very high blood pressures and pipes. Next comes the dalak massage. As you know, massage comes from the Arabic word mas, that means to rub. There are many types of massage. If you go on, it will be like hard massage, soft massage, and many, and so many oils are mentioned in Unani medicine. Rogane khust, rogane surukh, and many oils for different diseases. Next comes the riyadat, exercise, which is the most important regime to be followed today. And in this also the old physicians, ancient physicians, they have talked about walking, running, jumping, horse riding, swimming, wrestling, and boxing also. Nutul, that is called irrigation therapy. In this method, certain medicated water or medicated oil is poured on different diseased part from a certain height. It is very effective in depression, anxiety, and in some of the lifestyle diseases also.
Is it like Shirodhara? Is it like what people know as Shirodhara?
Yeah, exactly. But this involves the medicated oil will be different from them.
Hmm.
The absent is the sixth bar. Absent, that the lower part of the body from the hip is immersed on warm medicated water or warm plain water. It is very effective in treating piles, treating rectal, anal, intestinal, uh, uterine disorders, and even in urinary bladder disorders. The next is Pashoya, that is foot bath, which is immersed in warm water and warm medicated water. That is very effective for insomnia and headache. Hammam, the Turkish bath. This is a very interesting thing. This bath has three rooms. For the first room is of the normal temperature, the second room will be a little high, and the third room is almost of about 42 degrees Celsius. We will sweat like anything. This is called as the silent doctor. Turkish bath is
Right.
called the silent doctor. So
I've had hammams in Morocco and in Turkey. So yes.
that my father-in-law has built this Turkish bath in our place in the whole uh, India. No one has built like him. We'll show that inshallah sometimes.
Oh, fantastic. That sounds amazing. Is this at the hospital where you are? No.
No, we
Okay.
are but in the same city where he lives. So that is very important hammam. It opens the skin pores and excretes the waste products and refreshes the body. And
Okay.
next is
No.
food. The fumigation, as I told, it is very important for disinfecting the surrounding air. Even in COVID pandemic, the Unani physicians advised to do buhur, and it really helped.
The dhuni.
Dhuni, yeah,
Yeah. Yeah, we do that in our houses for
exactly.
decades as well. Yes. Interesting that that should be part of a therapy. That's fantastic.
So these were some of the important regimenal therapies.
So now I want to ask you about chronic illnesses. Are there any chronic illnesses which you have seen have been completely reversed using Unani medicine?
Many stories like that. Uh, can say one or two. Definitely, Unani system of medicine works wonders in chronic ailments, especially asthma, diabetes, hypertension, kidney failure. Our hospital has 18 plus years experience in treating kidney failure patients. They
Oh,
come out of
wow.
they come out of dialysis and transplantation also. Those patients who are doing dialysis, along with that, we say to take Unani medicine and gradually decrease their frequency of dialysis. And at one time, they totally stop the dialysis, and the kidneys, even the laboratory parameters, the creatinine level, the urea level, everything comes to normal. Just yesterday, one patient, her creatinine was 10, and just taking 1 month of medicine, it came to 6.
Oh my God. Amazing. That is amazing. Now tell me about a situation where you've helped reverse asthma, where you or someone you know has helped reverse asthma.
Many patients, many clients of us, they have come out of inhalers and nebulizers. We have special medicines in Unani medicines like that herb called kakra senghi and hostis, push. And it really makes wonders. And we also prepare a thing called, which is made up of menthol, thymol, and camphor. This it was also prescribed during the COVID pandemic. It is called Arke Ajib. 1 drop of it should be put and steam inhalation, and the entire respiratory tract uh, clears up.
Wonderful. Wonderful. We also like to leave our listeners with practical tips. So, are there any simple Unani practices that you can recommend? I know you've given us a wealth of knowledge and a wealth of information, but is there something simple that people can incorporate into their daily lives, which you will say can help them with health and with wellness?
Of course, which I have told you, following the principles of Asbab Sitte Zaruri are the six essential factors that is very important in our daily life. I have a small poem, which is written by myself for the listeners. Unanify your life. Balance your humors, normalize your temperaments, honey your face, green your tea, saffron your milk, cumin your water, gingerize your foods, pepper your soup, cup your muscles, purify your blood, rest your body, treasure your health.
Lovely. That was wonderful. That was absolutely wonderful. But tell me, you mentioned mizaj or temperament, right? Now, there is so many mental health issues today. Is that something the Unani medicine can help with? Mental health issues?
Definitely, definitely. We have a separate subject called Amradi Nafsani, psychiatric disorders, anxiety, stress, depression, and melancholia. All these are due to the black bile. We say whatever the mental issues, mental diseases, mental disorders are due to the excessive and the imbalance of the black bile. And recently, we saw a patient. She was from UP, had a lot of depression, and she had gone just taking our medicines for 3 months. She came out of depression.
Lovely. And what about something like uh, digestive issues, which again is prevalent all over the world? I guess it's an excess of yellow bile or an imbalance of yellow bile.
Unani, we see the temperament of the person, of the disease, and then prescribe the treatment of the opposite temperament.
I
Since
see.
it's hot and dry, we will prescribe those diet and those drugs which will be cold and moist. Be it any humors, yellow bile or bile, phlegm or blood, all these humors are made in the liver. We call liver as the factory of the human body. Whatever the disease is, mostly all the Unani physicians first they give liver corrective medicines, hepatoprotective medicines, and there are amazing hepatoprotective medicines. Like the one is Kasni. Kasni is Chicorium intybus. Gallen has called it as the friend of liver.
Oh, okay.
So, and it is said that if you take care of your liver will take care of you.
Yes, absolutely.
So there, yeah, if yellow bile is increased, first we will correct the liver, and then we will give yellow bile purgatives to eliminate that excess yellow bile. We have yellow bile concoctives and purgatives like we say senna leaves, shahitra, sid, aloe vera, gule surf, aloo bukhara, gule barafsha. So in diet include lot of vegetables like spinach, and as I told, since yellow bile is hot and dry, we will include those diet which is cold and wet, like fruits like pomegranate, watermelon, and vegetables like cucumber and bottle gourd. And hydration is also very important. Avoid tea and coffee, spicy foods, and if there are digestive issues along with that, small combination which we can make at home, the powder of fennel seeds, the soap, zira, and the dry ginger. Make it into powder, put a pinch before meals twice daily.
Before meals. Okay. Okay, wonderful. Also, Dr. Safina, can you tell us a story about maybe a patient whose life was transformed by Unani medicine?
As I earlier said, there are many stories of transformation. One businessman from Kerala, he had this liver issues, liver problems, along with cardiac issues and skin allergy, and he went into total depression. He left his business and everything. And once he started our Unani treatment, because Unani treatment has a holistic approach for all the illnesses. And he suffered and a lot, and he lost his confidence because of those skin allergies and other issues. But after taking our medicine, gradually he came out of all these things. Even all his parameters came to normal. All his skin allergies faded away. It was a real story, and he came and met us with such happiness to us.
Wonderful. And tell me, diagnostically, how do you diagnose? Do you also do you feel people's pulse? From memory,
Yeah,
that's what I remember.
yeah. Unani system of medicine. There are three things in diagnosis: the pulse, urine, and stool. We do
Hmm.
pulse, and the two things is, as I told, the temperament. It is very important to know what sort of person the disease has, not what disease the person has. This is the concept of Unani. So
Interesting. Interesting. Very interesting. Thank you, Dr. Safina, for your passion and your knowledge of Unani medicine. We're really grateful for your help. And to our listeners, we hope today's episode has burnt the fire in your mind to learn more about Unani medicine. We hope you'll explore it. There is so much richness in the ancient cultures and in the ancient medicinal systems. And we hope we've taken you a little closer to leading a healthier, happier life. Thank you so much and see you next time.
Minimum needle, maximum cure. A good acupuncturist is someone who will insert very few needles and should get maximum cure.
Chinese medicine is coming more from Taoism, which is more about coming from a lot more like a sage kind of approach, isn't it? It's more like the Yoda, it's more like Yoda from Star Wars, It's allowing the change to happen by being the right conduit for that, I think.
Yin and yang exist in everything in nature, and it's important for them to be in balance, even in the human body. And that really is the basis of TCM.